This is very exciting. You're about to transition from our hospital to adult care. The good news is that you're not doing this alone. There will be a team of doctors that will help you through this process. What you will have to do is to try to make them part of your journey and to try to stimulate them to address any medical problems that you may experience, some of them which may be new, because now you're an adult in charge of your health. Good luck.
It's really important that you start to take responsibility and an interest in the care that you've been receiving up to now. Your parents aren't going to be with you all the time. In fact, as you start to go to visits, you should ask them to leave so you can understand what it's like to look after things for yourself. And you're going to have to learn and understand what the problems have been and what the possible solutions are, working with your doctors and nurses after you leave SickKids to help you have the healthiest life you can.
I have total confidence that the next step in this journey for your health care will be exciting. It will be new and we will have some challenges, but I have confidence that you will enjoy it and that you will continue to do well. SickKids wishes you only the best.
Congratulations on graduating, and I want you to remember that you can always take someone with you as a support person, and because you're dealing with issues below the waist and under the radar, it can be difficult to deal with some of the emotional issues. You know that from your time here at SickKids. If you feel you need to talk to a mental health professional, ask your healthcare providers. They will refer you to a social worker, psychologist, psychiatrist, and take care of yourself. Good luck on your journey.
The transition to adult care means you're growing, and we'll be there with you to help you move towards another amazing journey. Parents, please allow for trial and error. Remember, this is a learning curve. Teens, challenges will definitely be there, but with your family's love and support, independence can be achieved. Don't forget to prepare for clinic visits ahead of time with questions.
So being a parent of a chronically ill child for 18 years, having SickKids as your security blanket, moving into the adult facility was overwhelming and very, very scary. We really wanted to let Caitlin be her own advocate. Leading up to leaving SickKids, transitioning from SickKids, for a full year we worked on updating Caitlin's medical records, updating her history, updating her journals, so that she could then understand, what she's been through, so that she can now give the new doctors that information.
So I know when I was leading up to going to my first appointment, I made sure I had my notebook with all my medical history and all my doctors' names, just so I knew what I was going into. And I tried to make a connection with my doctors prior to actually leaving SickKids, so that I knew that my doctor at SickKids was able to be in contact with my new doctor. I think the biggest thing is just knowing that it is going to be different and it is going to be a big change. You really need to be responsible for your own care. I suggest keeping a journal, asking questions whenever you're concerned or curious, and just make connections so that you feel safe and secure in your new environment.
Congratulations on your graduation from SickKids and your transition to adult urology care. The process on our end is we'll wait to hear from your SickKids urologist, and then we'll issue an appointment for you as a consultation back down to their office at SickKids, and they should be in touch passing on the appointment and what you need to bring. It's always a really good idea to request copies of surgeries, any recent x-rays or imaging, and recent consultation notes so that you'll have them for your personal records and be able to share them with any physicians caring for you in the future. At Sunnybrook, we have an amazing staff of very experienced nurses, admin assistants, and allied healthcare professionals. We all look forward to meeting you and helping you with your transition to adult urology care.
I'm a urologist who works here at St. Mike's, and I specialize in the treatment of patients with kidney stones. You may be referred to us from SickKids for your kidney stones, and if so, you're in a place where kidney stones are our #1 priority. You may simply need some diagnostic testing, but in some situations you may need treatment, which can range from non-invasive treatments right up to surgery. But if you do, we'll take you through the process step by step. At St. Mike's, you'll meet a team of nurses, administrative staff, and physicians whose only goal is to look after you through this process, and if you need us, we're here for you.
We want to congratulate you on your graduation from the Hospital for Sick Children, or SickKids. We are delighted to welcome you into our clinics just across the street. You may see a urologist like myself or one of my colleagues at one of our 3 hospitals. These include the Toronto General Hospital, the Toronto Western Hospital, or Princess Margaret Hospital. Our nurses and administrative staff are looking forward to welcoming you into our clinics. When you arrive at the hospital, you may be asked to fill out some questionnaires. You will be provided with some information about tests that you may be having done, and then you'll have a chance to meet one of the surgeons, physicians, or our residents or fellows. We understand that it might be a little bit scary to leave SickKids, but don't worry. We're really looking forward to seeing you soon and welcoming you in our clinics.
Congratulations on your graduation from SickKids. Transitioning to adult care is a huge step, but thankfully to see me, you only need to cross the street. My specialty is fertility, and you might be referred to us for consultation and monitoring. Your fertility might be the furthest thing from your mind right now, but my team and I are here and ready to explore your questions and assist when that time comes. Know that you can come and meet with me alone, but your family is also welcome to join us as well.
Hi, I'm Mandy, and this is Abby. We're nurse practitioners in the Pediatric Urology Clinic, and you may also see us in the Transition Clinic.
At the Transition Clinic, we can help you discover how to plan, track, and prepare for your upcoming graduation. This could be either through going to your primary care provider, this could also be going to a urologist in your community, or it could be here in Toronto as a specialty urologist. Good luck and happy graduation.
It takes a lot of work to prepare our children to face the adult world, but I feel we've given them the tools they need, and with our support and the doctor's support, they definitely will be okay.